All right, good afternoon, everybody. You're all very welcome. My name is Elaine Kinsella, as most of you know, and I'm Assistant Dean for Research in the Faculty of Education and Health Sciences. So thank you very much for joining us today, especially when the sun is shining outside. So I really appreciate you all coming today. So today's EHS Knowledge with Impact public lecture showcases a great example of research that connects learning, lived experience and community engagement in a very meaningful way. So we're delighted to welcome Dr. Dympna Tuohy, an Associate Professor in the School of Nursing and Midwifery, who will be sharing her work entitled Learning from Each Other, Developing and Incorporating Intergenerational Cafés within a BSc Nursing Programme. So Dr. Tuohy brings to this work decades of experience as a nurse educator and practitioner. She's taught and supported students at all levels of nurse education, from undergraduate through to postgraduate, and has played a key role in curriculum development, assessment design, and student supervision. Dympna's research is deeply informed by her clinical background and a long-standing commitment to older adult care. Her doctoral work explored older women's experiences of ageing and health in Ireland, and she continues to build on that foundation through projects such as the Intergenerational Cafés, designed to bridge understanding between student nurses and older people, and through collaborations with institutions like Queen's University Belfast on delirium education, among other initiatives. Her work doesn't just enhance learning, it addresses real-world challenges and aligns closely with UN Sustainable Development Goals, including good health, well-being, quality education and reduced inequalities. So it's a real privilege to have Dympna here with us today. So please join me in welcoming Dr. Dympna Tuohy. Thank you.
Thanks very much. I'm delighted to be here, and I hope you will get some interest or some knowledge about what we are doing. As I say, I'm representing really a whole team of people that have been involved in the past on developing the research aspect of this intergenerational cafes, but also we have embedded it within our curriculum, and we'll continue on within the nursing and midwifery to build on this area. So I will go through the overview for this lecture. I'm going to describe the original online intergenerational cafe research project and the development of the initiative. Then I'm going to talk about how it's now incorporated within the BSc Nursing Programme, specifically Year 3 Nursing in Primary and Community Settings module. Just give you a quick overview of some of the publications that we have from the original research and our thoughts about what we're going to do next. So here is the original team. There's quite a few of us, as you can see, and the majority of whom were from Nursing and Midwifery. We also had representation from the School of Design and a senior administrator who works in the corporate office. So just to go through this. So the background, I suppose, really to our research, our initial idea is that we know that with global aging, that this is a real and I suppose nice opportunity that we're all living longer. But with it, that we need to consider that the different needs of an older population. We know that in Ireland that over 14.5% of the population are age 65 and over, and that within the EU, about a third of people are over 55. And we know that by 2030, 1/6 of the global population is going to be over 60. We also know, and very much so in nursing, and that older people and nurses do work together. And it's recognised that most nurses will, at some point in their career, look after older people, be that in community care settings or in acute care settings or residential or rehabilitation units. And so it's really important for both the older people that they care for and the nurses that provide the care that they can work collaboratively together. The idea, well, we know that often our student nurses do placements with older people, both in acute and residential care settings, but they are seeing older people within the context of the older person being unwell or having an illness. And what we wanted to do was to go back and really start to look at how students and older people can meet and learn together as people first, not as somebody who has an illness or anything like that. And so there has been quite a lot about intergenerational learning in the literature over the last number of years. And I've given a definition there of that. But I suppose realistically what it is, it's a planned opportunity where one or more learning outcomes or aims across generations can be developed where people learn from each other. So it can be that they're learning about insights from each other or skills or particular knowledge. And we also know from the World Health Organization that intergenerational learning does reduce ageism and prejudice towards older people. And it is one of their pillars for reducing ageism, along with policy and education. So that's context for where we were going with this research. So our original research had two aims. One was to evaluate the effectiveness of intergenerational cafes as a way of facilitating intergenerational learning, and two, to actually ask the participants whether they thought any actual intergenerational learning occurred. So this is the slide, and I'm going to talk you through this slide here. Way back in 2020, we were given some money through HIST HRI funding to develop our cafe. And we were all excited and we were going to do a face-to-face. Then COVID hit and we decided, right, okay, we can abandon this for a while, or we can actually go ahead and do an online cafe. So we decided to go with the online cafes, and we actually ended up doing 3 of them back in the midst of 2021 spring. So what happened was all our students were, nursing students were doing a particular module on primary and community care in 3rd year. And they were now all online. They didn't do any placements during that period. We wanted them to participate in the online cafe, aside from the research. I'll tell you about the research in a second. And then we recruited older people from, I suppose, nationally, really, because it was online. So we actually were able to locate people or get people to volunteer from all over the country. And this was through print media in the local area, but also through retirement groups, also National Volunteer Ireland, and through snowballing and church services. So once people had agreed to participate, we sent out a pack because we wanted to keep the ethos of the cafe, if you like, on board. So within that pack, we had sent out a sachet of tea, coffee, a biscuit. We had a little notepad, a bookmarker, and of course the invitation reminding people of the date and the time of the cafe. We prepared the students whilst they were in class, online class, on what to expect from the cafe, and we also explained about how to log on, etc., and all of that, even though they were becoming very familiar with this at this time. From the point of view of the older people, we sent an information pack about how to join and to make sure that they had the MS Teams app downloaded on their device. And we also offered them one-to-one, guidance if they would have liked to have done that prior to the cafe, none of whom actually availed of that. So when everybody joined the cafe, how it worked was they all joined this big virtual room, and we introduced the cafe. We had a guest speaker because we thought it might be nice to have somebody to set context, and this was a leading nursing practitioner and I suppose national lead within Ireland on older person care. We also did a cafe charter, and then with the help of 2 of our people on the team, we actually then allocated people to breakout rooms. So prior to the breakout rooms, we explained the format. We wanted the cafes to be small groups, maybe 5 to 6 people, 3 students, 3 older people. And we also gave a guide just maybe to hint on questions if people were struggling to talk about, to kick off the conversation. But these were basic things like, hello, how are you? Who are you? Where are you from? What are you interested in? And some people stuck to that, and we didn't want them to necessarily stick to that, but you could talk about whatever you wanted, but maybe just to get the conversation going. The rest of the team, of the research team, we were facilitators, and we would dip in and out of the breakout rooms just to make sure that everybody was okay and there was no technical issues. And the 2 members of the team who were dealing with all the technical issues were then able to be, I suppose, to deal with any problems with connectivity and stuff like that. So after about 45 minutes, people had their conversations, and then everybody came back into the big virtual room. And we facilitated feedback from everybody as to what they thought of the cafe and the process, but more specifically as to whether any intergenerational learning did actually occur. So, and then once everybody was happy and we had an open forum, if anybody wanted to talk, and they did, and they contributed further to that. So following that, then we thanked them, obviously, and then they had a choice what they would like to do. They could say, right, I don't want to do any more with this, or they could participate in the research. And so it was with the research aspect of it, the type of design was implementation science research design, using a participatory approach and using CFR, Schroeder as our consolidated framework for implementation research. Obviously, we had ethics, and we invited both cohorts, the older people and the students, to participate. And this was an anonymous survey questionnaire. So they didn't have to if they didn't want to, but we actually did really, really well because 50 out of the 55 students participated and all of the older people participated as well. It was an online anonymous survey, and there was a survey questionnaire about 47 Likert 5-point scale, and then 5 qualitative open-ended questions. We also, ourselves as facilitators, we also did a group debrief, and we analysed that data as well. But our primary focus today is on the students and the older people. So once we've gotten all of the data, and the questionnaires, I suppose, really involved what learning did happen, if any happened. What did they think about the older person or the students now? How did they feel about participating in the cafe? Did they think the cafe was any good? And how they felt about the organisation. And then there were some free comments in the qualitative data as well. So we analysed it by using descriptive statistical analysis, and we also did thematic analysis from Braun and Clark. Following that, we then did a post hoc secondary CFR analysis by mapping all of the data gleaned from the questionnaires and the qualitative data, and we mapped it to various code books that we devised from the domains to do with CFR. And if anybody wants to know more about CFR, I can talk to that later. So what did we actually find? We found that there were a number of things. The main themes were talked about the process of participation, talked about conversations and connections, and talked about learning. The quantitative data supported the findings, which illustrated mutual understanding that the cafes enabled the people to have. But we also identified a few very specific things. There were some positive aspects about the organizational factors, such as needed to be organised, have sufficient time, and so on, and that these were all important for the cafe. More students felt that the purpose, the topics, and the online organisation was clear. The older people, less so. More older people wanted more time in the breakout rooms and wanted more time in the big discussion groups. It should be pointed out that some of the older people did experience technical difficulties, but this was partially due to internet connectivity problems, and also for some, they used devices that they weren't familiar with. Probably an easy enough assumption, you think everything was fine, any laptop is a laptop, but I suppose that was a learning for all of us as well. But we had suggested doing a run through, but as I say, nobody at that time felt the need to do it. All agreed that the cafes were a way of increasing intergenerational learning, and they were worthwhile, and they would have liked to have a series of them. From a teamwork point of view, we felt that it worked really well. We were had been working very closely together in the lead up, and I suppose we were really in sync, if you like, as a team. So that brings us then to where are we now? So we then decided that based on the findings of the research, that this was a worthwhile initiative. And we've now incorporated the intergenerational cafes in person on campus in spring semester. And it is now embedded in our third year BSc Nursing Programmes. And these students are general intellectual disability and mental health. And it is in the primary and community settings module. And we have a new team. Some of our original team moved on to bigger and better things. And we have a new team now of course directors, other colleagues, and people working, nurses working, facilitating placements, and so on. So how does it work now? So What we do is we offer an intergenerational learning program that comprises 8 hours involved in their module, in their primary and community module. It's a short program. It's a blend of theory and practice. It has 4 parts. We put a PowerPoint presentation up on Brightspace. We have selected readings, and they have to attend and participate in the cafe. And then there's personal reflection time. So what we've found now with hosting it on campus, it provides an opportunity for an informal setting. People come, they have conversations over tea and coffee and scones, and it enables them to get to know a little bit about each other as people first and foremost, and it helps break down the barriers. I just want to show you some images from our most recent cafe. And we got a birthday cake because we're 5 years doing our cafes now. And this is how the tables are set up. You can see that there are 3 older people and 3 students, or a little bit more. It's not an exact science. You kind of go with the flow on the day. And we have exactly the same format. We have an introduction. We go through the plan. People have their conversations. We as facilitators are moving around the room, making sure everybody is happy and no questions, and making sure if they want refills of tea and stuff like that, we get all of that in as well. And then we have a plenary, if you like, session coming back, and everybody talks us through what they thought of the situation and the cafe. So there's more photos. And that's some of the young team, and these are some of the students and the older people posing there on that one. So what is the evaluation so far? Well, anecdotally and during oral feedback, the older people at this cafe were positive about the experience and felt that they had developed insights into students' lives. They welcomed the opportunity to share their life experiences and their stories, and they're talking about how aging, what it means to them, and how they are navigating it and experiencing it. And I suppose for many, it's another phase in their life where they're using it as opportunities to do things that they didn't have time in their previous years. They also use the opportunity to voice the type of care that they would like from healthcare providers, which is very valuable for us. And it's good for us and for the students to hear it straight from the people that they are going to ultimately be caring for. I'll just talk you through some of the points from, there was 25 students attended, because remember, this is a self-selection process. So 25 of the students decided to come to the cafes this year and do the intergenerational program. They all strongly agreed that it was worthwhile, that it was relevant, it was positive, it contributed to intergenerational learning, and they would recommend it. And most strongly agreed that it broadened their understanding of older nursing practice for older people, and 4 agreed. There were some take-home messages. They felt it was of value. They saw it as building bridges. They felt that there was an emotional connection, and active listening is hugely important in older person care. They realized that fear of dementia can be a big concern for many older people. And they recognize that it's important to break down stereotypes, and that many older people are very active and busy in their own life. They also made some very clear suggestions about improvements, such as bigger venues, keeping an eye on the noise, and maybe mixing up with more student cohorts, first years, etc. And I'll come back to that in a moment. Okay, so here are some of the outputs from the research. There are a number of papers that we have published. There's a 5th one being written at the moment. We've presented at various conferences, and we have an actual report, an online one and a physical one in the library. So our conclusion is that we feel it's important to continue to develop intergenerational learning opportunities between student nurses and older people, and indeed other healthcare professionals. And we are currently exploring ways to do this with some of our colleagues in the other schools. We also know that UL is an age-friendly university, and one of its key principles is to promote intergenerational learning to facilitate reciprocal sharing of experiences between learners of all ages. So we feel that our initiative dovetails very well with this age-friendly university status that UL has been afforded at the beginning of this year. So I just want to talk to our acknowledgements and thanks, and that's it. I'll just go back there again. I suppose really what we're saying is that we want to extend intergenerational learning approach through much more of our modules, and not just have it as a cafe, because not everybody wants cafes, but to think up and to work and to see what kind of intergenerational learning opportunities can be developed to embed them in our curriculum at all years. So go back into my thanks. So I just want to thank our participants, the students and the members of the public over the last 5 years. Obviously, our HIST funding, our heads of schools, Dr. Christine Deasy and Professor Pauline Meskel, Professor Alice Coffey, who's now retired, but she was really encouraging and informed us about the HIST funding originally. Of course, our social media, Alison Claffrey, who takes lovely photos and puts them all up on social media. And thank you for taking the time to attend this. So thank you very much.
Thanks a million, Dympna. Thank you so much. That was really fantastic. It was great project. God, it's got all the good feel factors, but you can see the kind of impact and the extent that this project could be expanded to really continue to make a big difference across the campus and across the community. So absolutely fantastic. Really work. And it really just reminds me how just even small pots of research funding can go such a long way, and how important it is that we have mechanisms for supporting these kind of projects in the university. So really well done, and congratulations to yourself and all the team.